una po, gusto ko magpasalamat sa Couples for Christ Cooperatives Federation po sa binigay po na time ninyo para po makapag-reorient po tayo ng ating plan benefits po. So to begin po, gusto ko lang po magbigay ng brief background di One Co-op Health. Bali si One Co-op Health po ang kauna-unahang nagbibigay po ng need and health services sa ating fellow cooperatives, federations, and non-government, non-profit na stock organizations with cooperative-related programs and services. Bali si Co-op Health po ang kauna-unahang duly licensed cooperative health maintenance organization dito sa Pilipinas. So kung saan po ay formerly regulated po siya ng DOH from the year 2015 to 2017 and transferred under the Regulation of Insurance Commission from the year 2018 up to present, while being regulated and governed by the Cooperative Authority. So, sino-sino nga ba yung leaders behind the continuous success of One Co-op Health? Ito po ay sa pamumuno po ng aming Major General Gilbert S. Lianto, AFP retired, at ng aming CEO, President Dr. Paul Alan Espina. So, bali, ito po yung ating plan benefits po. Ang ating premium po ay nagbabari po siya sa ating edad po. Kapag ang edad po natin mag-fall sa from 12 years old to 65 years old po, ang plan po natin is 4,140. Ages 66 to 70 years old po is 8,280. Then 71 to 75 years old po is 12,420. Meron po tayo dito maximum benefit limit na 60,000 per illness. So, bali pagka nagpa-member po tayo kay Co-op Health, nag-enroll po tayo ng health plan, ito po yung ating magiging effective date. Kapag ka po na-receive namin yung Excel file na listing po ng on the 6th to 28th day of the month, ang magiging effective date po ng plan natin is on the first day of the following month. Halimbawa, ayan po. So, halimbawa itong 21st to 31st of the month po, mag-i-effect po yung ating plan ng on the 16th day of the following month. Let's say ngayon po namin na-receive June 23, 2023. Ngayon namin na-receive yung listing, ang card po natin, ang plan po natin ay mag-i-effect sa July 16. Ganun po siya. May cut-off po tayo. First to 5th day of the month naman po, mag-i-effect po yung plan niya on the 16th day of the same month po. Please take note po, if the enrollee missed to renew their plan and exceed the 90 days grace period, the member will be tagged as new enrollee with new effective date. Therefore, pre-existing illnesses will not be covered. So, sa halagang 4,140 po, ito po yung ating mga plan benefits na pwede po nating ma-avail. Yan po yung preventive or the annual physical examination. Outpatient, ito po yung consultations and laboratories. Inpatient or confinement. Emergency treatment. Dental coverage, financial assistance, telemedicine, COVID-19 benefit, and the eye care benefit po. So, isa-isahin po natin yung ating mga benefit. Let's start with the preventive healthcare services. Ito po yung ating tinatawag na annual physical examination. Ang cover po natin dito is yung ating basic 5, yung chest x-ray, complete blood count, urine test, stool test, and the physical examination. Bali, ma-avail po natin ito 3 months po after na pag-enroll natin kay One Co-op Health. Bali, si Couples for Christ po is magsisend lang po sa amin ng request letter. Nakalagay po doon yung name lang kung sino magpapa-APE. Preferred date. Sa preferred date po is dapat 3 to 5 days prior po sa APE date is nakapag-send na po tayo ng request. Then, once na po na-receive namin yan, yung medical department po namin is i-coordinate po yan sa kung ano pong nilagay yung preferred na clinic po ninyo, diagnostic clinic kung saan po kayo magpapa-APE. So, next benefit po natin sa outpatient care services. Dito po is 10,000 per year po yung ating coverage, subject to maximum benefit limit. Cover po natin dito yung medical consultations, laboratories and diagnostic tests, minor procedures conducted inside the doctor's clinic or outpatient department, at saka yung mga gamot po na binigay po ni doktor habang nandun po tayo sa loob ng clinic ay cover din po natin yun. So next po natin is the inpatient care services. Dito po, ito po yung confinement. Please take note po na net of PhilHealth po tayo dito. Inclusive po yung doctor's fee, room accommodation, medicines, laboratories, and other diagnostic tests done or given during the confinement. Sa unang pagka-confine po natin, sa kung anumang sakit po, hanggang 30,000 lang po muna yung ating pwedeng magamit. Pero if ever po, anbawa, sa mga susunod na buwan, na-confine po tayo, tas ganung sakit pa rin po yung dahilan ng pagka-confine natin, kung ilan po natira dun sa 60,000, halimbawa po, sa unang pagka-confine ninyo, 20,000 pa lang po yung nagagamit nyo, then, bumalik, just so happen po na na-admit po kayo with the same illness, so yung 40,000 po na remaining dun sa 40,000 sa pangalawang pagka-confine ninyo is pwede na po iyon ma-maximize. Pero po halimbawa, na-confine kayo pero ibang sakit naman po yung dahilan ng pagka-confine nyo, balik po tayo dun sa 30,000 sa unang pagka-confine since yung ating plan po is per sakit po siya. So if ever naman po magpapa-upgrade tayo ng ating room, let's say since ayun po, award po yung ating plan, tapos nagpa-upgrade po tayo ng room, ang 30% of the total hospital bill net of PhilHealth po is i-shoulder po yan ni member. Or basta lahat po ng excess na hindi pasok sa coverage ni member is i-shoulder niya po yon. Pero if ever po kapag due to unavailability in bed in ward, o di naman po kaya is due to medical case na nangangailangan tayong ma-isolate, ang first 24 hours po doon mako-cover ni One Co-op Health except lang po sa suite room. Pero sa mga susunod po na araw after 24 hours po kapag hindi pa rin po tayo nalipat sa ward room, ang lahat po ng excess po sa hospital bill po is i-shoulder na po siya ni member. Please take note po na ang take-home medicines, yung mga nireseta po ng doktor, kapag po for discharge na po tayo, hindi na po siya included sa ating plan. Part na po siya ng ating exclusion. So ito po ang approval of laboratory request based on CPGs. Ang CPGs po, ito po yung clinic practice guidelines. As HMO po, we follow what we term as clinic practice guidelines, CPGs. CPGs serve as guide to help decide which tests are necessary or not in the diagnosis of the patient or should come first before proceeding to other related tests. So, ito po yung sinusunod po ng mga HMO. Na perfect example po dyan is, halimbawa, UTI po, na some doctors would be quick to request for urinalysis and ultrasound of the urinary tract infection just because they know that the patient is an HMO card holder. But CPGs would dictate that simple urinalysis alone would suffice to give us a baseline assessment for the UTI. So, ayun po, kumbaga hindi naman po hindi lang naman po namin basta-basta disapprove yung mga claims po natin, yung mga availment natin. Sumusunod lang po tayo dito sa clinic practice guideline po. Kaya importante po na kapag po nagpa-check up tayo, tapos may mga laboratory request po si doctor, napaka-importante po ng supporting diagnosis po. Na dapat po yung laboratory nire-request ni doctor is related po siya sa kung ano po yung binigay niyang diagnosis. So next benefit po natin is the emergency healthcare services. 24/7 coverage po siya sa lahat ng emergency cases nationwide. Then, for reimbursement naman po kapag wala po tayong accredited hospital sa area. Sa ating emergency po, ang cover po natin dito, 30,000 per year subject to maximum benefit limit. Ang example po ng ating emergency cases, yung vehicular accident, animal bites, fall, burns, cuts, poisoning, and gunshot wound. Then, sa animal bite cases po, yung mako-cover po natin dito, single dose of anti-rabies, anti-tetanus, or anti-venom. Dito po, regardless po kung ikailang turok, basta yung mako-cover lang po ni One Co-op Health is isang beses lang po. So, next po natin is the special COVID-19 coverage. Dito po, ang sa special COVID coverage po natin, for outpatient lang po siya, na if ever po na may sintomas tayo, tapos, nung pagpa-test po natin, nag-positive po tayo, ang mako-cover po natin dyan, 10,000 per year, wherein sa RT-PCR test po, 2,000 pesos po. per test, then 1,000 pesos po per test sa antigen test. So next po natin sa the dental coverage. Sa dental po, ito po yung simple tooth extraction. Covered po siya maximum of 2 teeth per day. Then sa temporary filling naman po, ito po yung temporary pasta ng ating ngipin. Covered po siya maximum of 2 surfaces per day. Then permanent filling po, ito po yung permanent pasta. Wala po tayong coverage. Then simple oral prophylaxis po, ito po yung simpleng linis ng ating ngipin. Covered po siya once a year. Then, for reimbursement po, if ever wala po tayong accredited dental clinic sa area, for reimbursement po siya ng 250 pesos per procedure. So, next po natin is the financial assistance. Ito po ay hindi po namin pinopromote. Ito po is just in case lang po na may mangyari sa ating enrolled member, ang kanyang beneficiary po ay makakatanggap ng financial assistance for natural death, 10,000. Accidental death o di naman po kayo sa unprovoked murder and assault, 20,000 pesos po. Please take note po na meron tayong 30 working days from the date of death to complete all the required documents. Hanggat hindi pa po kompleto yung ating requirements, hindi pa po natin yan mapaprocess. So, next po natin is the telemedicine. Ito po yung aming newest in-house telemedicine na One Co-op Telehealth. Ayan po, pwede nyo po siyang i-download. Then dito po sa ating One Co-op Telehealth, pwede po tayong dito magpa-consult, follow-up check-up, kasi yung ating mga e-doctors po dito is nagbibigay din po ng e-prescription, e-medical certificate, e-laboratory request, na ito po is isi-send sa ating email address after po ng ating consultation. Ito po is kung yung mga simpleng karamdaman lang naman po, like inuubo, sinisipon, na need lang po natin magpareseta ng gamot, ito po, pwede natin gamitin itong telemedicine. Pero kung mga emergency cases, punta na po tayo sa pinakamalapit na hospital. So, meron lamang po tayo ditong 3 steps kung paano po mag-pabook ng appointment sa ating telemedicine. First po, send lang po tayo dun sa Facebook page ng One Co-op Telehealth. Accomplish po natin lahat po ng information na kakailanganin for appointment setting. Then once na-fill out na po natin, na-accomplish na natin, ang request po natin is ipaprocess po ng aming telemedicine team. Then later on po, magkakaroon na po tayo ng online consultation schedule po. Next po is the eye care benefit. Ito po is in partnership with Executive Optical na meron po silang 266 branches nationwide. Dito po, free eye check-up po tayo, refraction and color blindness test, guaranteed discount up to 30% on all signature frames and sunglasses, free minor repair services, and free cleaning po. Bali, pagpunta po natin sa EO, present lang po natin yung ating card. So, next po natin is the hospital income benefit. Ito po is optional lang po. Choice po ni member kung dun sa 4,140, willing siya magdagdag ng 500 pesos para po magkaroon ng coverage na ito. So, bali ang HIV po natin is applicable lamang po sa confinement. If ever ma-confine po tayo, magkakaroon po tayo ng hospital income na 200 pesos per day. Maximum of 30 days po yan. Then, sa medicine subsidy naman po, sinasabi ko nga po kanina, ang take-home medicines po, if sa pagka-discharge natin is hindi natin na-cover. Pero once po na meron tayong hospital income benefit, magkakaroon po tayo ng medicine subsidy na 4,500 pesos per year po. Then ambulance transfer po, hospital to hospital, 2,500 pesos. Please take note po ng ating hospital income benefit po is for reimbursement po siya. Then yung 10 days, meron lang po tayo ditong 10 days ng testability period and subject to exclusions. So, ito po yung mga sakit na makukover natin sa unang pag-member po natin kay One Co-op Health. Nandyan po yung acute pancreatitis, acute bronchitis, acute appendicitis, allergies except asthma, amoebiasis and other forms of gastroenteritis, bacillary dysentery, brucellosis, chickenpox, constipation, conjunctivitis, ito po yung sore eyes, dengue fever, heartburn, hepatitis A viral, impetigo intestinal parasitism, influenza, iron deficiency anemia, laryngitis, malaria, measles, otitis media, pharyngitis, rubella infantum, scarlet fever, sinusitis, tonsillitis, typhoid fever, and other enteric infections, UTI, itong urinary tract infection, whooping cough, upper and lower respiratory tract infections. So, next po is the pre-existing conditions, meaning ito po yung mga sakit na mako-cover po natin. 1 year po after ng pagpa-member natin kay Co-op Health, meaning po upon renewal po ng ating health plan. So, bali, ito po yung ating mga pre-existing illnesses. Nandyan po yung tumor, cyst, or masses, old infarct, seizure disorders, ito po yung epilepsy, eye disorders and disease, hypertension, endocrine disorders, cardiovascular diseases, pulmonary disease, collagen disease, gastrointestinal disorder, hernia except those under exclusion, calculi, gynecological disorder, arthritis, prostate disorders, skeletal deformities, and yung ating migraine po. Please take note po, any of the above pre-existing conditions may be excluded lifetime from coverage by an endorsement, which is made part of the contract on a case-to-case basis and subject to the limitations and conclusions. So, next po natin is the exclusions po. Ibig sabihin po, ito po yung mga sakit na kahit anong mangyari po is part po, hindi po talaga siya part ng ating plan. So, nandiyan po yung mental disorders na nangailangan ng psychiatric care, abuse of intoxicants, self-injury or attempted suicide, rehabilitation, treatment, purchase of durable equipments, long-term care. So, ito po yung detailed ng ating exclusions. Yung mga additional hospital charges po and physicians, professional fees, kagaya po ng sabi ko kanina, kapag gusto po natin magpa-upgrade ng room, extension sa hospital po, kahit na may order na po ng doctor na pwede na tayong lumabas. Mga fees po, like yung mga assistant surgeons for surgeries with less than 250 RUB units, use of extra bed, TV, electric fan, mga ganun po, extra food, toilet articles like face towel, so toothbrush and the like, difference in room and board accommodation, services of a private or special nurse if ever mag-request po tayo ng special nurse. Then psychiatric diseases including its treatment, long-term rehabilitation and psychiatric care, developmental disorders including functional disorders of the mind, long-term rehabilitation of neurological conditions, and all types of aneurysm and angiography. Yung brain surgery rin po, hindi po cover ng ating plan. Open heart surgery, autoimmune diseases, chronic renal diseases, maternity care. Lahat po ng related sa pagbubuntis, nasa exclusion po natin siya. Congenital, genetic, and hereditary diseases and their complications. Circumcision, prescribed medications for hormonal replacement therapy. Sexual transmitted diseases, ito po yung mga hepatitis, cancer treatments po including but not limited to chemotherapy, aesthetic, cosmetic, ito po yung mga pagpapaganda po. Halimbawa po, nagpa-piercing po tayo, then nagkaroon po ng infection, any beautification po is hindi po ng cover ng ating plan. Blood dyscrasia, human blood products like platelets, PRBC, plasma, etc. So, all expenses related po sa bloodletting, yung pag-donate po natin ng dugo, then pag nagkaroon po ng infection, di rin po cover. Then, diseases po na dineclare na epidemic or pandemic ng Department of Health o kaya ng World Health Organization is part po siya ng exclusion. Special exception po sa COVID-19 since kooperatiba tayo, so C1 Co-op Health po ay nagbigay pa rin ng coverage para sa COVID-19 po. Lahat po ng screening test hindi rin po natin cover. Halimbawa po yung sa COVID, na-expose po tayo, may nakahalubilo tayong nag-positive, tapos parang tayo gusto lang natin makamake sure na kung hindi tayo nahawaan, kaya magpapatest tayo, hindi po yun cover. So, dapat po maging symptoms at positive result po yung ating test po. So, all vaccines and immunoglobulin and other biological products, all expenses incurred in the process of organ donation and transplantation, any complications resulting from dental condition, ayun po, yung take-home medicines, hindi po siya cover, purchase or lease of any durable medical equipment, cost of medical services and professional fees in excess po dun sa ating plan, sa ating limit, then treatment for injury and its complications, treatment of any injury received wherein there is negligence, then treatment of injuries or illnesses caused by direct or indirectly by engaging any professional sports or hazardous activity po. So, treatment of injuries resulting from direct participation in riots, yung sa gulo po, work-related injuries, illnesses for those working under hazardous conditions, procurement or use of corrective appliance, artificial aids, etc., experimental medical procedures and its complications, acupuncture, acupressure, chemotherapy, and other forms of alternative medicine and their complications, routine physical examinations required by obtaining or continuing employment. Hindi rin po siya cover since part po siya as screening. Then custodial, domiciliary, and convalescent and intermediate care. Benefits covered by PhilHealth, hindi rin po natin pwedeng ma-cover. Hospitalization and treatment abroad, nasa ibang bansa po. Prescribed medicines for outpatient cases including vaccines. Medical certificates po, part po siya ng exclusions. Weight reduction programs, laser therapy such as but not limited to LASIK and PRK for treatment of error of refraction. So, bali ito po yung ating magiging card. If ever mag-member po tayo kay One Co-op Health, nandyan po sa front view mo yung ating policy number, pangalan, yung plan type, card number, tsaka co-op name. Then, sa likod po, back view is details po siya ni One Co-op Health. Bali, free card replacement po tayo. If ever po damaged na or hindi na po nababasa yung ating card o kaya hindi naman po kaya is mali po yung spelling ng ating pangalan at fault po ni One Co-op Health. Magkakaroon lang po tayo ng replacement fee na 250 pesos if ever po nag-upgrade po tayo ng plan. Nagpapalit po tayo ng surname sa mga babae po nating member na nagpakasal na. O di naman po kaya is nawala po yung ating card. Bali, swipe card na po tayo. Introduce ko rin po yung aming One Co-op Health mobile application. Itong One Co-op Health na logo. Downloadable po siya sa ating both iOS and Play Store po. So, bali dito po, pwede po natin makita ang accredited hospitals, clinics, and doctors ni One Co-op Health. Pwede rin po natin ma-check dito yung ating availment history. So, as of June 15, 2023, sa hospital po, meron na tayong total na 303 accredited hospitals. Sa clinic po natin, 574. Dental, 181. Optical, 272 with a total of 1,330 accredited providers nationwide po. If ever po na may mga madalas ko yung puntahan ng mga hospitals, clinics na hindi pa po namin accredited, pwede nyo po ibigay sa amin yung details ng hospital or ng clinic para po mapa-workout po namin sa aming providers team para po ma-accredit natin sila. So, ayan po, ang head office po namin located dito sa number 49, Nabilis Street, Barangay Peñahan Central District, Diliman, Quezon City. Nandiyan po yung email address namin, website, and contact numbers po. So, lagi po na yung tatandaan ng aming kooperatiba, inyong kalusugan. Thank you po.